Dear students, today we'll discuss a, an interesting entity that is upper limb gangrene. Probably spotted, but much more to learn about that because it is often an emergency condition in a vascular setup or in any way wherever a patient comes. Now, before going to that, we'll discuss the favorite MCQs. First, we'll put into that. So, just to go through this MCQ, Lerche syndrome is A, B, C, D. Put the right answer in the comment box. I appreciate and acknowledge your answer. Before going for second MCQ, I request you to subscribe my YouTube channel, share with your friends and colleagues, and view and see daily lectures or MCQs to learn surgery on day-to-day basis about images, X-rays, clinical cases, brief procedures, CT scan, operative procedures, so many things in daily for 5 to 10 minutes lecture. That will be very, very helpful to learn surgery day-to-day basis because this YouTube channel is free and you can spend a few short period and learn daily. So, and also we'll have live sessions once in 2 weeks or 3 weeks wherein a student will present a case, and other than me, other senior faculties will join for the lecture and as a faculty, and we'll have interaction for nearly 1.5 hours and discussion mainly very, very useful for your CBME case presentation, practical exam, and learn important surgical aspects properly with interaction. Very, very useful, and also will give a certificate if you join live, and it will be very, very useful for your future career. Again, request you to subscribe my YouTube channel. We'll go to the second MCQ. The commonest artery involved to cause intermittent claudication of the lower limb is A, B, C, D. Put the right answer in the comment box. I acknowledge your answer. We'll go to the what this clinical entity is. So look at that. Look at that. You can see the upper limb here. You can see the elbow joint here. You can see, this is the forearm. You can see the black area here. See that? Everything is black. It becomes up to here, it is black. You can see that. And see that there is no clear demarcation. That means it's an acute episode. So probably it's a wet gangrene. And this wet gangrene is spreading proximal. You can see some edema in the proximal forearm also. And probably it is an acute condition. And so naturally in the upper limb, because it's in the upper limb, so it is acute upper limb ischemia. So there is an entity, peripheral arterial disease, in that chronic limb ischemia, maybe lower limb or upper limb. Chronic limb ischemia is common in the lower limb. Acute limb ischemia can occur both in the lower limb and upper limb. In upper limb, acute limb ischemia is commonly seen when there is a trauma and embolism of different causes, maybe cervical rib, maybe posterior dilatation, maybe atherosclerosis, maybe trauma due to fractures, elbow fracture and other things. So that will cause spasm of the artery and limb go for gangrene, where immediate intervention is required as a golden period for such vascular phenomenon episode causing gangrene, acute gangrene is 6 hours, remember, because tissue will die afterwards, may not be able to salvage the functioning limb. So you have a functioning limb, should intervene and perfuse the limb within 6 hours. So golden period is an MCQ question is 6 hours. That point is very, very important. And two causes we have to always remember in acute ischemia is trauma, embolism. Embolism may be from the cardiac event, maybe artery, subclavian artery or other atherosclerotic event, maybe so many other causes. So many causes are there. Commonest cause is cardiac, of course. And other than atherosclerosis, thrombosis of the proximal vessel, which dislodges a thrombus and causes emboli. So many causes are there, which you can always go through my manual of surgery chapter, peripheral arterial disease, arterial diseases, which gives detail about the embolism and also gives detail about the upper limb ischemia. So you can always go through my manual of surgery, and for examination of these cases, clinical method surgery, which gives a live demonstration also how to examine such patient. We have to examine the neck For cervical rape, you have to examine the pulse, brachial artery pulsation, and subclavian artery pulsation, other artery pulsation. You have to compare opposite side. You may have to use a Doppler, arterial Doppler study, and eventually you have to do an angiogram and immediately intervention you have to do. May you have to use intervention radiologist help to immediately do an embolectomy. You have to start heparin also and reperfuse the limb. If that is not suitable, that is not feasible, that is a failure, then you have to do a open embolectomy with the help of a vascular surgeon. Even general surgeons who are well trained with the vascular surgery can do this open embolectomy to save the limb. Early intervention is important. Golden period is 6 hours because tissue will die afterwards. So that is a very, very crucial period. It's very important. So open the vessel, remove the embolus, reperfuse the limb, then suture the vessel with the polypropylene 5060 sutures, whatever it is. Then continue the heparin anticoagulant, avoid the sepsis, avoid and prevent reperfusion injury. Reperfusion is very dangerous. And other metabolic problems also can occur, metabolic, renal failure, all those things, myoglobinuria, all those things can occur in a reperfusion injury. So this is the very typical upper limb, acute upper limb ischemia. It is often a main question for you. Short note can be asked. Cervical limb is a short note. Different clinical tests, Addison test, then elevated arm test, Rose test. All those different tests are there. You can always go through my clinical methods in surgery, which gives a detailed methods of these tests, how exactly it is done, you should know. So that's also, in manual also it is there, how to manage these patients with the investigations properly, how to do embolectomy, different types and so on. Embolectomy is a short note for you also. So this is acute upper limb ischemia. So these are the things you have to remember, already told. Revascularization syndrome, sepsis, of course. If there is a delay, if your reperfusion or embolectomy is a failure, either open or intervention, then limb will go for frank gangrene and will not be able to save the limb. They will land with the amputation, probably below elbow amputation. So upper limb amputation is rather because functioning is a problem, writing is a problem. So it is better to try to save the limb as much as possible. Early identification, early intervention is the most crucial thing when you manage, especially acute upper limb ischemia. So refer my manual of surgery and clinical methods of surgery for examining such patient and managing such patient, including my operative surgery with the 2-volume book, which gives a very detailed explanation and procedure technical aspects of managing such a patient. So quotation of the day, students: a single leaf can be a beginning of a forest, because one thing sprouts and forms so many things. That is so your beginning is very important for any work, for any achievement. You can't say within a day you do everything. Start slowly, then progress and furl everything. That is what exactly meaning is very, very useful for surgeons to progress their career. And students, I request again to please have my SRB's manual of surgery, which gives a detail about all as for CBMS syllabus, everything, general surgery, specialty, gastrosurgery, urology, neurosurgery, cardiothoracic surgery, arterial disease, breast lump, breast disease, thyroid, and entire general surgery, then instruments, anesthesia, adjuvant therapy, so many things, and with a lot of quotations, lot of illustrations, lot of photos, with investigation, treatment, everything with the online for each chapter MCQs are given. It's very, very useful for face your NEET or any other exam, any competitive exam. It is concise, but everything is there. So have my manual of book surgery to progress in your surgical career, and also always have my clinical method in surgery. It is in detail examination of each patient, like anything, general examination, breast examination, thyroid, arterial disease, varicose vein, swelling, ulcer, and of course abdomen examination, rectal examination, specialty examination. Everything is covered with the video for in each chapter, with QR code for video, how to examine each, suppose breast, hernia, hydrocele, how to examine. Everything is there, easier to understand, and also lot of photos with how to examine with the differential diagram in the tabular from each chapter. So we'll have a clear idea about the examination and live visual, this one through videos, to how to examine the patient. But remember, it is a clinical book, so there are no investigation management concept. Okay, so that is our brief orthopedic exams also there in that. So very, very useful book. So I have my manual and clinical methods in surgery book for your understanding of the subject. And also again requesting students, please subscribe my YouTube channel and share with your friends and colleagues. Press the bell and learn surgery on day-to-day basis about different aspects, and also join live session whenever it is there to improve your knowledge, to face the exam, face the practical exam, and have interactive session to learn surgery in a far better way, and also will get a certificate for the same. So students, I hope you understood this lecture very well. Thank you so much.